Feeling tired, stressed, and drained seems like the new normal nowadays. But what most people miss is that it's not necessarily all the day-to-day stress that's creating this or just getting older. In this video, I'll share the role hormones have in chronic fatigue and why rebalancing hormones are the ticket to jump-starting the battery. When people are feeling drained and fatigued, they usually just try to power through it. Little thought goes into nourishing the body better or getting the rest you need because our society doesn't teach that. Instead, it's just do it, grin and bear it, or just bring it. On top of that, people's game plan for quick energy is usually very harmful to your energy levels, gut balance, and hormone health in the long run. And these tactics also make it hard for them to manage their stress because they inflame the body, making matters worse. People usually turn to caffeine when they want to boost energy. What they don't realize is that ramping up your caffeine intake forces your adrenal glands into action and can literally overwork them. This can also cause them to produce high levels of cortisol, the stress hormones, which can drain your energy and completely wreck your sleep by messing up your circadian rhythm. They may also turn to sweets or carby or fatty foods to give themselves a lift, especially around the late afternoon when they usually feel their worst. While these quick fixes get them through the day, eating foods like this can create insulin issues down the road that can drain your energy even more. So these quick fixes, which are poor ways to manage external stress, can also ramp up your internal stress. If you think of your body in terms of a car, a lot of people are running around with the check engine light on and their gas tank is almost at E. Many people don't even know how long they've been running with the check engine light on because they just keep putting the pedal to the metal. This is the recipe for chronic fatigue and they have no idea how they got there. In fact, most people know more about their car than their own body. And they do right for their car, but not their body. When your car really stops, there are some serious mechanical issues and putting gas in it doesn't work. The same is true for your body. At Medical Direct Care, we teach people what to do to avoid from, quote, totaling their car, i.e. their body. We also teach them ways to rebalance for better, long-lasting energy. First, we really take a look under the hood to see where their hormone balance is by doing advanced testing and diagnostics. Some of the common things we see on a regular basis is that their insulin's off, stress hormones are high, or maybe their thyroid may need a tune-up. We also see that some people are dealing with low-grade infections and even stealth infections that were never treated. These can be major energy zappers, and once clear of these, their energy skyrockets. Each person is unique, but we can teach you how to refuel your body better so you don't feel like you're always running on empty. It's also about adapting better stress relief management and taking yourself into the body shop more often. Many people were never taught the proper way to deal with stress. So in our practice, we provide a lot of guidance around dealing with it. This includes dealing with any emotional trauma from the past and how to manage your mindset, looking at nutritional deficiencies and what you need for hormonal balance. This helps you to make power choices in the way you care for your body versus draining it. To go deeper on the topic of chronic fatigue, sign up for a free 15-minute discovery call where we can discuss your specific situation. Simply click the button below this video. This video is for educational purposes only. By watching this video, you acknowledge that it is not intended as a substitute for the advice provided by your medical professional. Use of this guide does not imply status as a patient or client of Dr. Gregory Fryer or the Medical Direct Care Wellness Clinic. If you have or suspect that you have a medical condition, contact your healthcare provider immediately. Do not delay seeking medical advice. Information and statements regarding dietary supplements have not been evaluated by the Food and Drug Administration or Health Canada and are not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before beginning a new supplement, especially if you are pregnant or nursing.